This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Thursday, May 7th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate your staying with us on Africa 54. The United Nations is boosting its appeal for billions of dollars in coronavirus aid. It says the money is needed to protect millions of lives and help stop the spread of COVID-19 in fragile countries. The UN's humanitarian office said Thursday the world's poorest countries are not expected to experience the peak of the virus until sometime in the next 3 to 6 months. But those areas are already seeing lost jobs and income, as well as tighter food supplies and children going without vaccinations. An earlier UN appeal requested $2 billion in funding. However, the agency now says it needs a total of $6.7 billion. The increased appeal includes adding 9 countries to the list of those most vulnerable, including the African nations of Benin, Djibouti, Liberia, Mozambique, Sierra Leone, Togo, and Zimbabwe. The chief of Africa's Centers for Disease Control and Prevention on Thursday is rejecting a claim made by Tanzanian President John Magufuli that coronavirus tests his country received are faulty and are giving too many false positives, according to Reuters. John Nkengasong told the media the tests Tanzania is using are working very well. He says the Africa CDC, along with the Jack Ma Foundation, a charity run by the Chinese billionaire, supplied the tests. Meanwhile, in West Africa, Nigeria says it is extending its ban on all flights an additional 4 weeks as part of new measures to prevent the spread of COVID-19. Aviation Minister Hadi Sirika says there is a need to train airline staff in new safety measures before any flights resume. There are nearly 3.8 million confirmed cases of COVID-19 worldwide, with 264,000 deaths, but almost 1.2 million people have recovered from coronavirus. The United States continues to lead the world with over 1.2 million cases and nearly 74,000 deaths, according to Reuters. Top U.S. and Chinese officials continued their sharp exchanges over the origins and response during the early days of the coronavirus outbreak. Beijing is accusing Secretary of State Mike Pompeo of playing politics, claiming COVID-19 originated in a Wuhan lab. But Secretary Pompeo is pressing for more information. VOA diplomatic correspondent Cindy Sain reports.
There appears to be no argument the coronavirus outbreak began in Wuhan. The dispute is how it happened. On Wednesday, Secretary of State Mike Pompeo faced intense questioning from reporters over his recent remarks that there is enormous evidence the virus originated in a Wuhan lab.
Here's how this could get solved really quickly. The Chinese Communist Party could do what they're committed to do under their obligation to the World Health Organization, to be transparent, to be open, to do the simple things that nations all around the world do to make sure that pandemics like this don't get out of control.
Meanwhile, in Beijing, China's foreign ministry once again denounced Pompeo for his remarks, accusing him of playing domestic politics.
Mr. Pompeo spoke repeatedly, but he has never presented evidence because there was just no such thing. So I think that this question should be left to scientists and medical control experts to answer, and the politicians should not keep lying on this issue for the needs of domestic politics.
Other countries want more information about the virus outbreak in Wuhan, including Germany, Britain, and Australia. Pompeo said Wednesday China should let its scientists come forward.
China is still refusing to share the information we need to keep people safe, such as viral isolates, clinical specimens, and details about the many COVID-19 patients in December 2019, not to mention patient 0.
Pompeo said his calls for transparency from China are not about politics, but about saving lives. Cindy Sain, VOA News.
U.S. President Donald Trump is walking back his previous statement to wind down the White House COVID-19 task force. He now says the group will continue, but with more focus on reopening the economy and developing a vaccine. White House correspondent Patsy Widakuswara reports.
As U.S. COVID-19 deaths climb up to more than 72,000, a reversal on the White House Corona Task Force from President Donald Trump, who now says it will continue indefinitely.
I thought we could wind it down sooner, but I had no idea how popular the task force is until actually yesterday.
Trump said he plans to add several more members to the task force and that the focus will shift toward reopening the country. But at this stage of the pandemic, experts say the U.S. should prioritize public health over the economy.
It's really important that the genesis of this not be with the idea that we are now over the public health emergency and we can just focus on the economic recovery. We're still in the midst of the first wave of the pandemic here in the United States, with approximately 25,000 new cases every day and nearly 1,500, almost 2,000 deaths daily.
The task force was established in late January to oversee the administration's effort in mitigating the spread of COVID-19. Vice President Mike Pence was named the chair a month later. Members of the task force, Dr. Anthony Fauci and Dr. Deborah Birx, are seen as respected and trusted figures.
The fact that there is at least one body that we know we can turn to for guidance, that's issuing guidelines, that's issuing policies, that's vetting information is really useful.
Trump said the expanded task force will also focus on vaccine development. While his administration declined to participate in a virtual conference on vaccine development led by the European Commission earlier this week, Trump said the U.S. is working with other countries.
Whoever gets it first, my hat's off to them. We're not looking for first, second, or third. We're looking to get a vaccine that works. And progress has been made.
American drug maker Pfizer said they have begun delivering doses of experimental vaccines for initial human testing in the United States. If proven safe and effective in trials, it could potentially be ready for distribution by the end of the year. Patsy Widakuswara, VOA News.
For some Egyptians, the impact of the coronavirus shutdown has been more frightening than the virus itself. With businesses closed, the poor are getting poorer. Now, as Egypt starts to slowly reopen, medical experts warn the nation can't handle a larger outbreak. VOA's Heather Murdoch in Istanbul reports with Hamada El-Rassam in Cairo.
In Cairo, these women are waiting for hours for food assistance. Many aren't wearing masks because they say they can't afford them. And they're not alone. 1 in 3 people in Egypt live below the poverty line. And for them, the mandated coronavirus business shutdowns have made it impossible to afford enough food.
أنا وزوجي ومعايا 2 ولادي ومعايا بنتي مطلقة ومعاها 3 ولاد وقاعدة معايا.
I live with my husband, 3 daughters, and 3 grandchildren. My husband is very sick. I was working as a school cleaner, but now I would take any job.
As coronavirus restrictions are being eased, the government says it has been supplying about 3 million people with food. That accounts for just 10% of Egypt's poor. Some Egyptians will be getting back to work this month when hotels and some other businesses reopen. The worry, many medical experts believe Egypt can't handle a larger COVID-19 outbreak.
There are very few hospital beds compared to the population of Egypt, and we don't have enough doctors.
One of Egypt's most important industries, tourism, has collapsed. The government says it will start reintroducing domestic flights and shorten the nighttime curfew this month. At the Giza Zoo, workers say the changes cannot come soon enough.
This is a public place. If people don't come out, we can't make any money.
The Egyptian government is strapped as well and has asked the International Monetary Fund for its help to recover. For VOA News, I'm Heather Murdoch reporting from Istanbul with Hamada El-Rassam in Cairo.
Nigeria has overseen a huge growth of locally owned and managed companies in its oil sector, but lower prices and COVID-19 are threatening the transformation. Nekachile reports.
Nigeria's economy is expected to contract by 3.4% this year, government officials said on Tuesday, as dwindling oil revenues coupled with a world under lockdown forced the country to assume a lower petroleum price of $20 a barrel. That's bad news for a sector that over the past decade has seen unprecedented growth in local capacity. In 2010, Nigeria enacted legislation to boost the number of locally owned and managed companies in the multi-billion-dollar industry overseen by the Nigerian Content Development and Monitoring Board, or NCDMB. Amy Jadesimi, managing director of the Lagos Deep Offshore Logistics Base, said the act was instrumental in shifting the market to a place where so-called local content was compulsory.
It also enabled private sector players such as LADO and the NCDMB, the board, to put in place long-term plans so that we could see over the first 10 years, which we're now reaching, a transformation in the capacity of the market.
But the economic headwinds now threaten such changes. Africa's top oil exporter relies on crude oil sales for around 90% of foreign exchange earnings and more than half of government revenue. But on Tuesday, Finance Minister Zainab Ahmed said Nigeria will be cutting its budget by around 15% and that major oil and gas projects will be delivered much later than originally planned.
That was Nekachile of Reuters reporting. Food prices are plummeting in the Democratic Republic of Congo in what the United Nations and some government officials condemn as unscrupulous profiteering at a time of international crisis. Angela Akumadu reports.
At Kinshasa's main market, shopper Miri is stockpiling tomatoes amid fears that the cost of food could again spiral out of control as they did when the Congolese government first attempted to impose a lockdown at the end of March.
Today, I see it got a little better, but when the government wanted to confine us for 4 days, one bowl of tomatoes cost 500 Congolese francs instead of 200 to 300 before. So today, I am buying more tomatoes and I keep them in the freezer because tomorrow everything can go up.
Higher prices, chalked on the board behind some stalls at Nkengasong market, are testament to a practice that has been condemned by the United Nations and some government officials as unscrupulous profiteering at a time of international crisis. But vegetable seller Lee Nsumba says she has to sell her produce at a higher price because the amount she pays for a box of tomatoes, for example, has tripled. Finance Ministry advisor Tripo Losa blamed a few bad faith Congolese, mostly resellers, and said the government has raided some wholesalers and deployed inspectors on the ground. Reeling from decades of conflict, Democratic Republic of Congo is already the world's second most food insecure nation, according to the UN's Food and Agriculture Organization. Despite having 80 million hectares of arable land with the potential to feed almost a quarter of the world's population, only 10% is cultivated and the country's infrastructure is in ruins, meaning it relies heavily on food imports. A spokesman for the FAO said more recent rises in food prices have been driven by trader speculation combined with panic buying and increased transport costs.
That was Angela Akumadu of Reuters reporting. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, a former Moroccan criminal now spends his time beautifying his city. We'll be right back after this break.
Time don't come, my people. Now you ready to ride? All my ladies,
Welcome back to Africa 54. Major airlines are now requiring passengers to wear face masks during flights to protect passengers and also crew members against the coronavirus. And as a temporary measure, some are blocking middle seats for free or charging for it to create spacing between passengers and suspending snacks and beverage services to limit interaction. VOA's Mariama Diallo spoke to CEO of Frontier Airlines.
Passengers are now required to wear a face mask or covering to board a flight on a major airline, including JetBlue, American, United, Southwest, Frontier, and Lufthansa, among others. Frontier Airlines Chief Executive Officer Barry Biffle says other measures are also being taken.
We started with enhanced screening procedures, as well as the fogging of our aircraft that kills the virus on contact. We started doing health certifications of our passengers almost a month ago. And last week we announced, which goes into effect this Friday, that everyone will be required to wear facial coverings.
Captain John Cox, former head of air safety for the Airline Pilots Association, salutes the move.
They're trying to be very conservative and doing two things. One is maximizing passenger safety, but also providing tangible evidence to the passengers that they are taking health and safety very seriously.
Many flights have been nearly empty since the outbreak started, but recently passengers started posting photos of more crowded planes with travelers who are not wearing face covering or observing basic social distancing guidelines. Passenger Princess Johnson describes a recent flight.
Like it was like a claustrophobic scene. That's how it felt to me, because we didn't have space. If someone sneezed, we all would have been sick.
But Mike Ritchie had a different experience.
Good flight, not so many people, plane got up fast, plane landed fast. The flight attendants made sure everybody was spaced well, and I'd fly again if I had to.
Southwest Airlines officials say workers are cleaning every surface of their aircrafts with an electrostatic disinfectant, which kills viruses on contact. Other measures, eliminating snacks and beverages to limit social interaction and not putting passengers in middle seats to ensure greater social distance. But other airlines are filling middle seats, saying requiring face masks is sufficient. Frontier is charging $39 to keep the middle seat empty.
For the last month, we've been blocking every other row. I know some airlines have been blocking some middle seats, but they're not guaranteed. And so that's why we introduced the guaranteed option of the middle seat being blocked next to you. But the bottom line is you don't need that to be safe on Frontier.
Biffle adds his company will receive $170 million in federal funds under the CARES Act passed in March that provides economic relief due to the COVID-19 crisis. This, he says, will help Frontier cover half of its payroll costs until September. Mariama Diallo, VOA News.
The COVID-19 lockdown has had some unforeseen consequences. For Londoners, it is introducing them to a breath of fresh air. VOA's Henry Ridgewell reports.
I've come outside to the park to record this diary today because I want to show you something that a lot of people have been speaking about lately, and that's the colour of the sky. It's absolutely clear blue. I live quite close to Gatwick Airport, London's second busiest, and normally it would be full of vapour trails from the aircraft, but there are none because, of course, many of the flights have been cancelled. There are fewer cars on the road, the air smells cleaner, there's more birdsong. Now, all these might seem like trivial things in the face of a global pandemic, but I think it's inevitable that people will look for the positives at such a time of turmoil. And people are starting to have the conversation about what sort of country and what sort of world they want to emerge after the coronavirus crisis is finished. Millions of people are working from home. Will the daily commute be necessary anymore, or can we save on those carbon emissions and let people spend more time with their families? What about those international business meetings that are now being held by video link? Can we continue with that kind of technology, but on a more personal level as well. I've been in touch with friends and family who I'd lost touch with before, and we're now having video conversations online, and we have a weekly event with close family where we all get together. There's a hope that that kind of relationships will continue. Perhaps the social media age is coming to an end and we're all craving once again human-to-human contact. And there are hopes in Britain as well that after the turmoil of Brexit in recent years that there can be some kind of healing. But there are clouds on the horizon. Another Brexit deadline looms at the end of the year, which could divide the country and create more economic problems. And perhaps the world will just go back to its own ways once all this is over. But the conversation has started where I live, and I think in many communities around the world. What kind of country, what kind of world do we want to live in when all this is over?
The lockdown is affecting millions across Nigeria. Authorities applied the measure weeks after Nigeria recorded a case of the coronavirus on February 27th. Reporter Timothy Obiezu says he is stuck at home, but is trying to make every moment count.
I had barely moved into my new house in this neighborhood 2 weeks before the lockdown was announced late March. I don't know many people yet, but my pet dog Sophie, she keeps me company. The lockdown does not restrict pet walks, so we do that a lot, or sometimes run to exercise and keep fit. When we return, I try to catch up with my family in Lagos. I visit them once a year since I left home to take up a job in Abuja 5 years ago. In late 2018, my 72-year-old dad came down with cancer of the trachea. For more than 1 year that he received chemoradiation, he was unable to speak clearly. It was the most challenging period for my family. But in March, he was declared cancer-free at the Lagos University Teaching Hospital, Luth. We were advised, though, to keep in touch with his physician. Good idea, we thought, until Nigeria's first case of the coronavirus was announced about a week later. Luth was one of the hospitals where the index case sample was tested and confirmed. My family decided it was better to cancel his hospital visits until this whole thing blows over. But the lockdown has been on for 5 weeks now. Early in the week, Nigeria's President Muhammadu Buhari announced the lockdown will be eased on Monday, May 4th, to reduce impact on citizens. But with over 1,500 coronavirus cases, Nigeria facing a high community transmission and millions roaming the streets, it is unclear what happens next. Timothy Obiezu for VOA News, Abuja.
U.S. lawmakers returning to Washington from their break are renewing their focus on how the Trump administration has responded to the coronavirus outbreak. President Trump blocked the nation's top infectious disease specialist, Dr. Anthony Fauci, from testifying before the Democratic-controlled House on Wednesday, even though he is set to appear in the Republican-controlled Senate next week. Here is VOA's congressional correspondent, Catherine Gibson.
As some U.S. states begin to relax lockdown measures, a warning to lawmakers about the country's death toll.
There will be, tragically, at least 100,000 deaths from COVID by the end of this month.
With Congress back at work in Washington, more questions about the country's response to the pandemic.
Should the country be reopening now? Are we ready? Is it irresponsible to open the economy without adequate testing?
Demonstrators around the country protesting coronavirus closures, visible signs of the country's larger debate over the balance between public health and preventing an economic collapse.
Even though the fight against COVID-19 is far from over, keeping businesses closed and workers at home is not a sustainable option for the long term. Our economies need to get moving again, and Americans need to get back to work.
Public health experts say that's possible with the right resources.
Even as we move towards reopening and as some states make that decision, we still need to be focusing on increasing our capacities to do diagnostic testing and to do contact tracing. The window we have to implement those interventions is still open.
Congressional Democrats say the Trump administration has no nationwide testing strategy and failed to supply personal protective equipment to healthcare personnel. President Trump told ABC News he blames former President Obama for the lack of resources.
The last administration left us nothing. We didn't have ventilators, we didn't have medical equipment, we didn't have testing.
Those claims will receive more scrutiny next week as Democrats ramp up investigations into the White House response and hear more about a top government scientist's complaint. Dr. Rick Bright is set to testify President Trump misled the public when he claimed a malaria drug was a cure for the coronavirus. Catherine Gibson, VOA News, Washington.
A reformed ex-convict in Morocco looks to make the best of his new life of freedom. Streets he once stalked as a criminal are today the focus of his local beautification efforts. And as VOA's Arasha Basadi reports, he may even offer a path for other ex-cons to follow.
Under the sun in Saleh, Morocco, sits a free man.
I have a criminal past. I did drugs and crime until I found myself in prison. Now on the outside, it's hard to integrate back into the community. They see a scar on your face, and they will never look at your personality.
El-Mindi Nur el-Din says something changed after his fourth time behind bars. He decided he wasn't going back and started making amends with his family and community.
Fixing things with the community meant fixing and cleaning the streets.
Despite the coronavirus outbreak, Nur el-Din checks on the elderly and delivers their medicine free of charge.
I could be infected with the virus because I'm moving around all day, but God will protect me because He knows I am helping people without waiting on a paycheck.
Seeing changes in his own life, Nur el-Din founded a community initiative to help rehabilitate other ex-convicts.
I was in prison 10 years. Nur el-Din changed in that time. When I got out, I found him painting the streets and planting them. I even found others who were once on the wrong path volunteering. So I decided to help and serve our neighborhood.
Since his release from prison, Nur el-Din has even earned an educational certificate in shoe manufacturing. He says he will continue to stay out of trouble, keep helping his neighbors, and beautify his community one brushstroke at a time. Arash Arbasadi, VOA News, Washington.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.